Startling news now from the Centers for Disease Control and Prevention about the fight against autism, a brain-based disorder affecting communication and interaction skills. Studies in the past convinced researchers that about 1 in 500 children suffered from autism. Now, the CDC reports that number could be as high as 1 in 150. And this month's cover story, Rod Starnes looks at the impact autism has on a family and how autism experts are combining forces here in the Mid-South to give families what they need when they need it.
Which map do you like?
Which map do I like? How about that space one?
At first glance, Charlie Cotier looks like a typical 5-year-old. He likes Dr. Seuss, enjoys drawing, and loves video games. But a few years ago, Charlie's mother, Jeannie, noticed behavior in Charlie that was anything but typical.
When he was 18 months, we saw him start to kind of go backwards and start losing words, but it wasn't all at once. It just happened gradually over the course of like a year maybe. And then you wake up one day and you go, you know, why can't he count to 20 anymore? Why isn't he interested in reading a book?
In addition to becoming less and less verbal, Charlie was becoming hyperactive, started covering his ears around increased noise, and stopped making eye contact. A doctor's exam confirmed the Cotier's fear. Charlie had autism. Jeannie remembers the day she heard the diagnosis as if it were yesterday.
Stunned. Even though there were whispers of it or someone insinuated that might be what it was, I guess I just didn't want to believe that that's what it was.
At this point, Jeannie and her husband Mike did what most parents would do. They devoted themselves to learning all that they could about autism. Their quest for knowledge on the World Wide Web led to a solution just down the street. It was here that they met the man who would change their lives forever.
Meet Dr. David Adams. Today, he's getting to know another parent with a child who's exhibiting symptoms of autism. Dealing with the disorder is something close to Dr. Adams' heart. Several years ago, his son, Zeke, was diagnosed with autism. He soon realized, as do most parents in this situation, that help and information are hard to come by. That's when Dr. Adams discovered the Autism Solution Center in Memphis. Here at the center, autism experts assist families from both sides of the autism equation, medicine and education. Dr. Adams knew he had to be part of this team.
There's only one other center in the United States that I'm aware of that combines the two at the degree that this center is looking at, where you're having the ability to access educational resources, where a child can come in and the parents can be informed of their rights under federal law, can be informed how to access the school systems, how to access the Tennessee Early Intervention System, how to get a child involved in the various therapies, and then secondly, to have the parents make informed decisions about medical treatments for their child.
Here at the center, parents can make those informed decisions because they now have an immediate channel to the latest in autism research. For instance, experts are now recognizing a link not only between autism and the brain, but a connection to the immune and digestive systems as well.
I think there is some really exciting evidence with some immune modulation therapy that's been going on. There's some exciting evidence with some simple and safe supplement-based interventions that seem to make a substantial difference in these children.
Dr. Adams recommended modifying Charlie's diet, which resulted in slight but noticeable behavioral changes. But as Jeannie discovered, with autism treatment, patience is certainly a virtue.
You don't do everything at one time. You do one thing at one time. It's very important in the treatment process that you keep track of everything. It's like Charlie is a TV in the old days with the rabbit ears, you know, and the little line is jumping back and forth. And every time we would do something, it was like you were moving the tuner button, and we took him off of something, and all of a sudden, you know, and then we do something else, and he was out of tune, and we're doing these things, and we're tuning him back in.
Also helping tune Charlie back in is a series of customized lessons, specifically targeting the type of communication behaviors Jeannie needs to address with Charlie.
And then you say what?
Let's go outside to swing.
He's using more words. He's looking at you and he's thinking, what do I need to say?
Through early intervention and intense treatment, Jeannie and her family have helped Charlie to the point of mainstreaming him into preschool. It was here that Charlie made one of his biggest steps to date.
They had a winter program where they had to get up on stage and sing some songs in front of the parents. And so I was I almost didn't go. I was so worried that when he saw me walk into the auditorium that he was going to start crying or run down, but he didn't. He walked right past us, waved, got on stage, got into his little songs. He did what he was supposed to do when he was supposed to do it. He had never done anything like that before. It was a miracle. It really, to me, I mean, to look at it and look back and look at everything we've been through, our whole family, Charlie especially, you know, for him to be able to be up there on that stage, laughing, having a good time, just brought it home to me that there's a chance for him. Whatever this whole experience ends up bringing him in terms of when he comes out on the other side of it, who he is, what he is, it's going to be fine. You know, he's just Charlie, and he's going to be fine.
Joining me now is Laura Corby, president of the Autism Solutions Center. Laura, thanks so much for joining us.
Thanks for having me.
One of the controversies surrounding autism is the claim by some that the MMR vaccination actually contributes to autism. What's the latest thinking on that?
The thing that I would say about it is we know that there's a genetic predisposition that's setting the stage, and we know that there are some kids that are definitely more vulnerable than others are. The most important thing is to vaccinate. We live in a global economy. We've got people coming in from who knows where and who knows what they have. So it's very critical that kids are vaccinated. We don't want to send out a message that vaccines are not important, but it's incredibly important to vaccinate safely, to do it very safely. That means spreading shots out over longer periods of time. It means ordering thimerosal-free vaccinations, and most importantly, talking to your doctor or a skilled organization like ours that can talk to you about the different types of things that are available.
This past December, President Bush signed into law the Combating Autism Act. Tell us the significance of that.
It's wonderful. It's giving us close to $1 billion in funding that can go towards research in other areas of autism. It's going to be laid out over a 5-year span. And part of it is going into educating physicians, which is very desperately needed. Getting the public more aware of what's happening and educating the public and the medical community as a whole. We know that there's a lot of money right now going into genetics and other areas of research, but what this does is it allows more funding to go into biomedical research, into gastroenterology, into immunology, into vaccination safety, and into many other areas that need to be looked at right now.
Laura, thanks so much for joining us. A lot of very good information.
Thank you.